So welcome back. Today we are in Washington, D.C. at the World Bank. And I am particularly excited because we have as our guest Jishnu Das, who is an economist at the World Bank. And Jishnu has really been at the frontier of thinking about and measuring healthcare quality in low and middle income countries. Jishnu, thank you so much for being here.
A pleasure to be here, Ashish. Look forward to it.
So, Jishnu, let's get right into it. There is a lot of interest in thinking about healthcare quality in high-income countries. There's been a lot of work that's been done in the U.S. and England. Most of us feel like we know less about the state of healthcare quality in low-income countries or middle-income countries. What is the state of healthcare quality in India?
I think it's fair to say that the state of healthcare quality in India is not good, and there are many, many ways you can look at that. First of all, the country is bifurcated in two, right? There's a better performing south and a worse performing north, and I think you see that in every health statistic that we have. The second part of it, which I think is less known, is that bifurcation carries over to healthcare quality. And you can think about that in a couple of ways. I mean, the one way I like to think about healthcare quality is to just, try and see what happens when you as a patient go to a doctor. And then say, how as researchers can we mimic that experience?
Yep.
How can I tell you a little bit about the average person who goes to the doctor and what happens to them? I think the simplest way to think about it is to say, pick a condition that's really, really salient. So for instance, we have picked chest pain in a middle-aged man, which usually in a place like the US, 98% of the times will be diagnosed correctly. And in the case we picked, for instance, if the doctor had questioned appropriately, done the right exams, he or she would have diagnosed it as unstable angina, or what's in common parlance called a heart attack. So we train people to depict these symptoms very, very carefully and send them to many, many doctors. And I think the simplest way you can think about poor health quality is you can ask, how many of these patients would receive the right treatment and nothing else? That answer is about 5%. So things get slightly better when you say, how many of these guys would have received the right treatment, but would have also received something else? Maybe the doctor did the right thing, but he also did a bunch of things that were not totally correct. So that's about 40 to 45%. But you're still left with a majority of doctors not being able to pick up, diagnose, or treat a very textbook case of chest pain that appropriately diagnosed and treated would lead into a heart attack.
Just so I understand what you're describing, you take standardized patients, people who've been trained, and you send them off, and about 5% of the times the physician gets it right and doesn't do anything else. And a majority of the times, they don't even get it right at all. So what's going on? Where is the failure? Are they not asking the right questions? Are they not doing the right exam? What do we know about why people have a hard time arriving at the right diagnosis and treatment?
The first failure could be that the doctor just doesn't know, right? I mean, the guy hasn't been trained, he doesn't have the medical knowledge, perhaps. And if he doesn't know that a chest pain could be a heart attack, maybe that's the biggest problem. And in fact, if you read a lot of the literature on healthcare, a lot of it is about, the massive shortage of healthcare workers or a staffing problem, and we don't have sufficiently trained doctors. The second part of it, which I think is less salient in the kind of health policy world, but hits us as patients every day, is that the doctor may not put in enough effort, right? So I don't know how many people have been to clinics in low-income countries, but unlike, say, clinics in the US, where you're cordoned off from the other patients, there's a door, you're alone with the doctor listens to you. A typical clinic that we'll work in, if you go in, there are 5 people sitting in the clinic. These could be patients, might be other people, might be friends, might be people from the community. The TV is blaring, the patient comes in, sits, the doctor is talking on his cell phone, he'll pick up every call. So it's an extremely distracted environment. There are various things going on, and you want to start worrying about, is the doctor putting in enough effort to look after you?
Yep.
Right? The third issue is sometimes, and this has been a worry especially with India and other countries, people think, Well, maybe the doctor's getting paid to do something which they know is not right. One way they think about it in India is maybe they're getting paid to ask you to get a bunch of tests done because they're getting kickbacks from the industry.
Yep.